Hi, good afternoon, colleagues. Great, thank you so much. Good afternoon, colleagues. Welcome so much to the special session on COVID-19 recovery in ASEAN. We're very grateful for all of your time. Apologies for the slight delay. We are waiting on our core moderator, hopefully Ms. Diane Curry, Chief Planner for Brisbane City Council, to join. But in the meantime, as I know many of you might be waiting already, and we just in terms of the time, please allow us to continue on. So if I can introduce myself, my name is Tam. I'm a Sustainable Urbanization Specialist with the United Nations Human Settlements Program, supporting our regional office for the Asia Pacific region, and very grateful to have a very distinguished panel of speakers and presenters who are joining us today to speak on the topic of COVID-19 recovery in ASEAN. So I would just like to start the session by noting that recovery is one of the three focus areas of the ASEAN Economic Community for 2021, and the other two being digitalization and sustainability. So in terms of the agenda for today, we'll start with a presentation on COVID-19 and its impacts. Following this, we'll hear a presentation on recovery strategies in ASEAN, which will include ASEAN's collective COVID-19 response, progress and challenges in the implementation of the ASEAN Comprehensive Recovery Framework, and we'll also hear presentations from colleagues from the Homeless People's Federation of the Philippines on recovery levers in cities, and we'll have open to a panel discussion amongst panelists before sharing an opportunity for question and answer from the audience as well. So thank you so much for joining us. So for the panel for today, we have Dr. Arti Garg from the Emergency Response Team at the World Health Organization Southeast Asia Regional Office for Southeast Asia. We have Dr. Ferdinand Fernando, Head of the Health Division of the ASEAN Secretariat, Mr. Arif Rizki Bakhtia, Senior Project Officer, ASEAN Comprehensive Recovery Framework Support Unit for ASEAN. We have Ms. Ruby Haddad with the Urban Poor Coalition Asia and the Homeless People's Federation of the Philippines. And we have Dr. Suraj Batari of the International Society for Urban Health. And shortly after, we also have as a discussant, Ms. Paula Penenin Ribeiro Hargrave, Human Settlements Officer of UN Habitat. So thank you so much for the opportunity to hear from, for joining us today and sharing your experiences. And if that's okay, we'll hand over now to Dr. Arti Garg from the WHO Southeast Asia Regional Office to give us a quick overview of COVID-19 and its impacts, trends on pandemics across several cities in the region, and practical actions for local authorities to consider. Thank you so much again, and over to you, Dr. Arti.
Thank you so much. A very good afternoon to everyone. It is both a privilege and an honor to be part of ASEAN Sustainable Urbanization Forum. I would now begin my presentation on COVID recovery in ASEAN in the context of COVID-19 and the pandemic. Now, this is a joint effort and presentation from World Health Organization with support from Dr. Nilesh Buddh, who is the lead for World Health Emergencies at our regional office. And we have Dr. Suvaji Good, she's a regional advisor with the World Health Organization. First slide, please. Let us begin with a global overview on where we stand for COVID-19. Currently, more than 235 million cases of COVID-19 have been reported across the world. The death toll stands at 4.7 million worldwide. Now, if we draw our attention to the graph on the left, we clearly see that the number of new cases of COVID-19, which have been reported from the beginning of pandemic, have varied across the region. Each day, the new number of cases reported were different in different regions, and they were different within the regions in different countries. Even the countries experienced that the COVID number of cases which were increasing were different in different provinces and subnational areas. These variations led to a peak-like patterns as waves we can see. The wave which we can see in the middle, that is from middle of March to middle of June this year, was primarily driven by tall purple bars which stand for the Southeast Asia region. That is the time that all the countries in the region experienced an intense transmission of COVID-19. Next slide, please. Now, when this wave-like pattern continues, what happens is the country, how does a wave formed is basically from no case to sporadic cases to clusters of cases, then intense transmission. It's throughout this time when there's an intense transmission ongoing and building, the countries, the cities, the region, the geographic administrative areas, they mount a number of adaptive responses. Now, out of those various steps which are taken, the most effective and the most important, which result in declining transmission, are effective coordination. Now, this coordination is national and subnational coordination, the coordination between the sectors. So it is multi-sectoral coordination, the coordination of the subnational with the national, which actually is the key in moving the transmission and declining the trends of transmission moving towards recovery. The second most important aspect of COVID response has been physical distancing, the public health and social measures. Let us detail this more on the next slide. Since the beginning of pandemic, all the countries across the world have resorted to public health and social measures. These are individual measures, they're also the environmental measures, they include surveillance, contact tracing measures, and the key objective is basically to slow down the spread of COVID-19 by breaking the chains of transmission. There were innovative methods which were used. There were physical distancing, as can be seen in Myanmar. They actually, and this was resorted to in different parts of the country, different parts of the world. There were markings which were seen to maintain social distancing. The communities, they stepped in to help the people, especially in urban slums where there is high density population, to maintain social distancing. Then adopting wash strategies was another important aspect which the volunteers and community engagement supported. The authorities, particularly the health authorities and the health system, it came forward and did all possible for testing, tracing, treating, and tracking the cases. Next slide, please. Now, these public health and social measures, they remain relevant even in the current scenario when we have variants. There is evidence to prove that all the chains of transmission can be broken even if they are caused by variants by distancing. Then, with the limited supply of vaccines, we actually have to bank on this public health and social measures till we move forward in recovery. So these measures, though they are absolutely critical, they had a huge impact on COVID response. We understand the cities and the urban areas, they are basically a hub of four key activities. One is the economic activities, the second, the educational setups, the third, the transport hub, and fourth, most important, I would say, is the health hub. The urban settings and the key areas, the metropolitans, they serve as referral centers for the wider areas around. Now, these stringent measures which were put in place had an adverse impact in all. The health systems were overwhelmed. When there were intense transmissions, we've seen across the world there was a scarcity of men, money, material, resources, logistic supplies were out of order. The transport was adversely impacted, and the worst effect was on the marginalized and the underserved sections of the society. The rural migrants, which actually wanted to get back to the rural areas or native places, there was a huge impact of transports which jeopardized the normal transport and communication lines. Education sector, it actually is a time to reboot our education system now. We've seen that digital technology supported both education and health sector. Next, please. So, what exactly this calls for? How do we need to build healthier cities? This impact and response of COVID has actually brought our thinking to adapt to transformative changes. The cities have to think and understand differently so that they can strengthen their health, equity, and well being. We need to focus on the innovative technologies and the means which have been developed. There is a need to harness on building the digital technology which has come up during the COVID response, as well as continue the momentum on multi-sectoral approach which we've seen during COVID, a whole of government, whole of society approach which came forward. But this is what the key is during recovery. We need to consider how to keep this going. So absolutely critical is the COVID impact and response is brought forward is the fact that it's a time to rethink on urban planning and also redesigning the formal and informal economic sectors. Next slide, please. So the emergency preparedness and strengthening of emergency is an ongoing and a continuous process. It is not that COVID has brought the focus on emergency preparedness. The key aspects which are given in the yellow bar here, which talk of strengthening the capacities for risk assessment, detection, monitoring, and stronger partner coordination. What COVID has brought forward is all these aspects, the key focus area, whether it is governance, whether it is financing, multi-sectoral coordination, communication, then looking after the areas where there's high density population and movement, all is happening, but where? At the national level. COVID has actually told that there is a symbiotic relationship between the cities, the urban areas, urban settlements, and the national response. The purple arrows, they actually talk of this symbiotic relationship and a very important aspect which needs to be strengthened. For a comprehensive emergency preparedness, we need to build healthier cities. Next, please. Certainly, COVID is an opportunity for building back better, but how? So, to support this how part, a number of guidance are available. World Health Organization has come up with a guidance which talks of strengthening preparedness for COVID in cities and urban settings. Next slide, please. Now, this guidance, it talks of 4 key areas which need to be focused. First and foremost, we need to focus on planning. There have to be flexible plans, multi-sectoral plans, multi-jurisdictional plans, which need to be built and adhered to. Then risk communication and community engagement is a very, very important aspect for building healthier societies. COVID has taught us that misinformation management has to be focused. Then timely application of public health and social measures. These measures have to be strategic, evidence-based, and targeted. Now, the point is that these public health measures have to be imposed or adopted in such a manner that they maintain the delicate balance between lives and livelihoods. Last, the most important, we need to ensure the health systems are strengthened to the core. These health systems are so resilient that they cater to both the emergency needs as well as the essential needs. Next slide, please. So this guidance is also accompanied by a practical approach which focuses on all these 4 areas and gives us step-by-step details of what actions have to be taken and how one can move from one stage of management cycle to the other, taking these step-by-step approaches. Not detailing it in the interest of time, but we'll be happy to discuss more about it. Next, please. So what actually brings forward to COVID response we see is a fact that the societies and the cities, they have to be built further. There is a lot of work to be done to make the cities responsive to the vulnerable populations, also responsive to the vulnerabilities of health and other sectors. This calls for a 3-pronged approach. One, accountable leadership. The other, we need to build the trust of the societies, and then participatory planning. The planning has to include all the sectors. Next slide, please. So just to conclude, I would say the key message here is the cities are an opportunity. COVID has given the cities an opportunity to build back better. What we need to focus on is a multi-sectoral, whole of society approach, which focuses on strengthening the capacities of detecting, preventing, responding to, and recovering from outbreaks and emergencies at the subnational level. It calls for stronger integration of all sections of the society, individuals, volunteers, private sector, civil society, all need to chip in well and together for the further recovery and building back better. So COVID response, something which COVID has actually done is brought this health emergency agenda um, on the topmost priority. The health emergency preparedness is a topmost priority with all our political as well as higher authorities in the organizations, in the countries, and at the cities and urban planning levels. Now, it is our duty to build on and cash on the momentum which is generated to effectively pave the way for recovery so that the cities are strengthened enough for any future pandemic or emergency. And that brings me to the last slide. I just want to thank you all and leave you all on a positive note that every accomplishment, it begins with a decision to try. Thank you so much. Tam, you're mute.
Thank you so much, Dr. Arti, and really appreciated the presentation. I was particularly interested to hear about the symbiotic relationship of cities and urban areas and national response. And I think that actually is a good segue into the presentation that we have next, which is from Dr. Ferdinand from the head of the health division of ASEAN. Dr. Ferdi, I know that you've been supporting and leading the health sector cooperation response, and I think it would be great to hear from you, for the participants here, about how ASEAN has come together and really supported this multi-sectoral and transnational response that was highlighted by Dr. Arti earlier from WHO. With many thanks, over to you, Dr. Ferdinand.
Thank you very much. Thank you, Tan. If possible, can I have my presentations shown on the screen? Thank you so much. A pleasant day to all of you. Thank you very much for inviting me to this timely event. As mentioned by our kind moderator, I will be sharing a certain perspective of the ASEAN health sector cooperation that is focused on COVID-19 response. Next slide, please. As mentioned earlier, globally, as of October 7, there have been more than 236 million confirmed cases of COVID-19. Kindly refer to the lower part of the slide. This would include more than 4.8 million deaths reported to WHO. Globally, case fatality rate is 2.0. There are regions that demonstrate a general downward trend of cases, but there are also countries within these regions that have surge of cases, particularly due to the variants of concern, such as Delta variant. In the ASEAN region, as shown in the upper part of the slide, according to the COVID-19 situational report by the ASEAN Biodiaspora Virtual Center, as of October 6, there were nearly 12.3 million confirmed cases of COVID-19, with more than 265,000 deaths, and regional case fatality rate of 2.2. This is higher than the global CFR, or case fatality rate, of 2.0. The confirmed cases in the region were 5% of the global cases. The 7-day rolling average of COVID-19 new cases in ASEAN region seems to be on the downward trend, but there are still pockets of surges of cases in some areas in the region. This situation that I've shared with you is based on the situational report of the ASEAN Biodiaspora Virtual Center, which will be updated within this day. This is a thrice a week report given to the ASEAN Secretariat by this center. Next slide, please. Globally, more than 6.3 billion vaccine doses have been administered. The COVID-19 vaccine report in our region indicates that majority of the ASEAN member states have more than 80% of the high-risk population with one dose of vaccine, and with ASEAN member states moving towards having more than 50% of the total population with one dose of vaccine. As of now, as you can see, there are only 4 ASEAN member states with more than 50% of the total population that has at least one vaccine. As may be seen from the various data sources, such as the WHO website and the ASEAN Biodiaspora Virtual Center, the ASEAN member states have been continuously conducting massive vaccine rollouts to achieve at least 10% of the population of every country by September 2021, at least 40% by the end of 2021, and at least 70% by mid-2022, as appealed by WHO among its member states. Hopefully, the ASEAN region will be able to move swiftly towards this target with collective efforts of relevant sectors and communities and stakeholders. Next slide, please. What is being shown here is the ASEAN post-2015 Health Development Agenda, which is composed of 4 ASEAN health clusters, namely the cluster on promoting healthy lifestyles, responding to all hazards and emerging threats, strengthening health systems and access to care, ensuring food safety. All of these clusters would contribute directly or indirectly with collective efforts on COVID-19 response. The ASEAN Health Cluster 2 on responding to all hazards and emerging threats are directly involved in COVID-19 cooperation, particularly focusing on initiatives on preparedness, prevention, detection, and response. Please be informed that there are also other sustainable cities initiatives that are not directly under the purview of ASEAN Health Cluster 3. Some of these are included in promoting healthy lifestyle. Next slide. In addition to the health portfolio of the ASEAN health sector, there are 27 health-related initiatives on COVID-19, which were mobilized as early as January of 2020. This would include initiatives that are already ongoing within the ASEAN Health Development Agenda and through the ASEAN Health Clusters. Among others, as highlighted here, would be initiatives on Emergency Operations Center Network for Public Health Emergencies, Network of Disease Surveillance and Laboratory, initiatives on Big Data Analytics and Management, and initiatives on vaccine security and self-reliance. This also include new health-related initiatives with partners such as the initiatives on the ASEAN Center for Public Health Emergency and Emerging Diseases, or ACFID, or ASEAN Center for short, the ASEAN Portal for Public Health Emergencies, the ASEAN Public Health Emergency for Coordination System, and a series of webinar that would deal with technical exchanges and recommendations through policy briefs that would involve particular expert panel from the region. This expert panel would be coming from the economic, health, or political sectors that have been involved on COVID-19 response. As shown also in the slide, there would be initiatives with other non-health sector that are also ongoing, which I will be discussing in summary in the succeeding slides. Next slide, please. Apologies for the small print, but this particular slide highlights that the ASEAN health ministers conducted a recent follow-up special video conference on COVID-19 response after 1 year. This was conducted in July 2022, and one of the agreements, of the ASEAN health ministers were documented in a joint statement wherein they agreed on or committed to enhancing laboratory capacity across the region and reinforcing genomic surveillance of COVID-19 virus so that the region will be able to swiftly detect and share information of potential variants of interest and variants of concern, and determine the public health and social measures and infection control measures. In this meeting, the health ministers also agreed further to strengthen engagement with all relevant stakeholders using a whole of government and whole of society approach. They also agreed to continue guiding the ongoing ASEAN health initiatives, and those initiatives I have already mentioned in the previous slides. It would include the 27 health-related initiatives focusing only on COVID-19. The health ministers also committed to continue providing guidance and support on the vaccine rollout in all ASEAN member states. They also would like to continue supporting the operationalization of the health-related initiatives under the ASEAN Comprehensive Recovery Framework, particularly those initiatives under Broad Strategy 1 in enhancing health systems. I will mention some components of this later, but then there will be another speaker who would be discussing particularly on ASEAN Comprehensive Recovery Framework. And also during the July 22 meeting of the health ministers, they strongly supported the sustained and scaled up cooperation among various stakeholders, such as our ASEAN dialogue partners and development partners in the collective response to COVID-19. Next slide, please. This slide shares with you the ongoing ASEAN health sector initiatives that were mobilized for timely and collective response to COVID-19 under our ongoing program on mitigation of biological threats. So through existing mechanisms under this platform, the ASEAN health sector has enhanced and sustained its response measures that were launched as early as January 3, 2020, in cooperation with partners when the first report of a cluster of pneumonia cases was shared by China through the ASEAN Secretariat. The ASEAN health sector continues to have technical updates and information exchanges, sharing of good practices, produce risk assessment reports, and enhance cooperation and coordination in preparedness, prevention, detection, and response among health and non-health stakeholders through these existing platforms. The sustained implementation of these activities are leveraged with the support of Canada and counterpart resources from ASEAN member states. And also, these projects would include the ASEAN Emergency Operations Center Network for Public Health Emergencies. And as mentioned earlier, the ASEAN Biodiaspora Virtual Center, which manages the program for big data analytics and visualization. The ASEAN Risk Assessment Risk Communication Center training on risk communication and risk assessment. And other existing health ASEAN cooperation with other countries and other partners. Next slide, please. This particular slide just highlights the scaling up of information and technical exchanges through the ASEAN Portal for Public Health Emergencies, the link of which is already shown in the slide. This was launched in July 2022 and was supported by Canada and the GIZ, or German Technical Agency. This PHE portal will enable real-time information sharing and expert discussion among ASEAN member states and partners. There would be dedicated sections in this platform that will only be accessible to ASEAN member states and ASEAN health officials. And there would be sections or layers of this platform that will be accessible to the public. Currently, this portal is in the final phase for enhancement and data integration or database integration. As mentioned earlier, we would just like to highlight that the ABVC, or the ASEAN Biodiaspora Virtual Center, continues its production of a situation report on COVID-19. But this particular project, or the Biodiaspora project, which is under this center, has been utilized since the threat of Ebola, Zika, and MERS-CoV. The ABVC continues to support ASEAN member states in maximizing the biodiaspora tools based on specific needs and context of ASEAN member states. So far, they have produced more than 225 reports since 2020 based on COVID-19 situation. In 2021 and ongoing to 2022, this particular biodiaspora tools from this center will be integrated into the portal of the public health emergencies. Next slide, please. In COVID-19 response, collaboration and solidarity is very critical. And we all know that this is an extraordinary and unprecedented global health crisis, and thus requires cooperation of all stakeholders, regardless of level of socioeconomic status, regardless of age, regardless of affiliation. The cooperation with various stakeholders, particularly dialogue and development partners, have been harnessed and enhanced through the health cluster country coordinators and senior health officials of the ASEAN Health Sector platform or mechanism. This resulted to ongoing and new initiatives that aim to enhance the current response and ensure future preparedness. And as shown in the slide, this would include initiatives with development and dialogue partners dealing with prevention, detection, and response. And this would include also the provision of medical supplies, the provision of vaccines, and also the provision of capacity building activities in terms of detection capacities and response capacities. Next slide, please. After several months of consultations through the support of Japan and based on the results of the feasibility study by McKinsey and Company in 2020, the ASEAN health sector has endorsed the establishment of the ASEAN Center for Public Health Emergencies and Emerging Diseases, or ACFID, or ASEAN Center. This will move towards further strengthening ASEAN's regional capabilities and capacities to prepare for, detect, and respond to public health emergencies and emerging diseases as a center of excellence and regional resource hub. This ASEAN Center will have three strategic focus pillars of prevention and preparedness, detection and risk assessment and response, and three overarching themes of information sharing and analytics, capacity building, innovation, coordination, and support. These are designed to contribute to meeting the proposed mission as a center of excellence and regional resource hub. The host country selection for this ASEAN Center will be finalized within this year, and preparatory operations are being done in parallel with partner agencies and partner countries such as Japan and Australia. Next slide, please. Now, following the adoption of the ASEAN Strategic Framework for Public Health Emergencies in November 2020 by the ASEAN Summit leaders, based on this document, the ASEAN Public Health Emergency Coordination System was initiated to support the implementation of this framework on PHE. This is in partnership with the United States through the USAID Prospect. The implementation of this multi-year program aims to institute a region-wide formal whole of ASEAN mechanisms to better prepare for and respond to public health emergencies. It also aims to harmonize existing, ongoing, and upcoming regional coordination among various stakeholders engaged in responding to all hazards and emerging threats. The program, through short-term technical consultants under the support of USAID Prospect, have already been undertaken, and there were several consultations and assessments made regarding the current situation of coordination of public health emergencies within the region, and there is already a draft outline of elements for regional coordination of PHE. There will be follow-up meetings and consultations with key stakeholders in the discussion of the draft outline of regional coordination of public health emergencies. The development of this framework and systems of or structure of coordination would allow an enhanced, coordinated, and harmonized coordination of various stakeholders, non-health or health stakeholders, in responding to public health emergencies. Next slide, please. Also, as shown, ASEAN has its existing platform in achieving vaccine security and self-reliance in the region. This slide presents the ASEAN Regional Strategic and Action Plan of the ASEAN Vaccine Security and Self-Reliance, or AVSSR. This particular action plan operationalizes the AVSSR declaration that was adopted by the ASEAN Summit leaders in 2019. And this particular plan has already been endorsed by the ASEAN health ministers and operationalizes the declaration that was adopted by our leaders in 2019. And as part of its initial phase of implementation, initiatives on COVID-19 vaccines resource mobilization, exchanges of technical information, and stakeholder coordination on vaccine support have been implemented and are ongoing. To complement other initiatives that I have mentioned earlier, next slide, please. You have the COVID-19 ASEAN Response Fund. This fund serves as a pool of financial resources to support ASEAN member states. The terms of reference of this fund was already adopted last November 2020, and it allows for the transfer of funds from other existing dialogue partner cooperation funds within ASEAN. And these funds will be utilized in the support of project proposals that are of immediate need, as well as long-term or medium-term proposals that would cater to research and development. Recent use of these funds have been allocated for the regional purchase of vaccines for the 10 ASEAN member states, including ASEAN Secretariat. Next slide, please. Another ongoing initiative that is also participated by the non-health sector is the ASEAN Regional Reserve for Medical Supplies, which would serve to enhance regional preparedness and capacity in response to needs for medical supplies during public health emergencies. Please be informed that the terms of reference of this particular initiative has already been endorsed last November 2020, and this is established to have a virtual warehouse. And it's not a physical facility, but it will consist of earmarked provisions to support the provision of medical supplies to affected ASEAN member states. Next slide, please. So this particular initiative is not only involving the health sector, but the various sectors coming from the ASEAN community pillars of the political security and economic security. What is being highlighted here is that there are initiatives that are part of the strategy on enhancing health systems. This particular ACRF, which will be discussed by the other resource speakers, would have a whole of community approach, which would be contributed by all three ASEAN community pillars. It would involve different phases of approach into the reopening, recovery, and resilience of the region and ASEAN member states. And the implementation plan presents initiatives and various program project activities that are really actionable and directed towards the realization of the 5 strategies of this ASEAN Comprehensive Recovery Framework. This ACRF requires strong commitment and support from all stakeholders, since it's a cross-sectoral endeavor, and it really needs to be effectively monitored and evaluated so as to track the ASEAN region's post-pandemic recovery. Next slide, please. I will not discuss much on this slide. Apologies again for the small print, but then I would just like to highlight that aside from included in these 5 broad strategies of the ACRF, strategy 1 is enhancing health systems. This is directly under the purview of the ASEAN health sector. The initiatives that I have mentioned earlier have already been realized and have been reported as ongoing initiatives under this strategy 1. Further discussions on this will be done by the next speaker from ASEAN Secretariat. With all of these initiatives, we would just like to highlight that what is critical in the COVID-19 response and being prepared for upcoming emerging health threats and future pandemics is really a collective response by all, at all ages, and by all populations, and by all people of different beliefs and races, as well as different perspectives. We just have to have a collective response in ending this COVID-19 and preparing ourselves for future pandemics and other health threats. With that, thank you very much for having me here. Over to you, Tam. Thank you.
Thank you so much, Dr. Ferdinand. And I think it's quite encouraging to hear that the majority of ASEAN member states are now, over 80% in terms of the vaccination rates, and it's quite a significant undertaking without a question. To our next presenter, I think we'd like to hear about one of the other flagship frameworks for ASEAN, which was touched upon by yourself, Dr. Ferdinand, being the comprehensive recovery framework. And of course, we recognize that health sector response is greatly influenced upon what are the relevant impacts in different areas, including human security and economic integration as part of that framework. So with many thanks, over to Mr. Arif Rizki Bakhtiar from ASEAN to share the next presentation. Over to you. Thanks, Arif.
Thanks, Tom, for the introduction. Good afternoon, ladies and gentlemen. It's a pleasure to be here And in this opportunity, please allow me to present updates, progress, including challenges on the implementation of the ASEAN Comprehensive Recovery Framework or ACRF. So, ASEAN Comprehensive Recovery Framework or ACRF is the whole of community consolidated exit strategy from the pandemic that is developed by the ASEAN. Can we go to the next slide, please? First slide. Okay, next. Maybe we can go to the next slide. As Dr. Furti has mentioned about the vaccination rates and the progress of vaccination rollouts in ASEAN. So we understand that the COVID-19 pandemic has posed us with the unprecedented challenges. We've observed in terms of the GDP last year was a bit bad for us with the contraction of 3.3% in 2020, but we have also seen the signs of positive recovery this year. We are expected, the economy is expected to grow at 3.1% this year and 5.0% next year, assuming we will have a wider vaccination progress as well as the easing of mobility restriction. So in terms of trade and investment, ASEAN committed to keep the region market for trade and investment. For example, in terms of trade, last year we signed the Memorandum of Understanding on the implementation of the non-tariff measures in selected products in goods. So last year we endorsed about 152 goods, mostly related to medical kits and medical supplies that keeps the trade in the region open. We've seen until the first quarter this year, the intra-ASEAN trade increased to about 24.7%. This is among the highest for the past 2 years, and the expansion in trade is contributed mainly by the increase of rubber and plastic, which is closely associated with medical devices and products. Um Beyond that, this year we also endorse another 107 additional tariff lines covering more food and agriculture products, hoping that this can also benefit and support our farmers and MSMEs in the region. In terms of employment, this year we project to have 9.3 million fewer workers to be in employment, but this is still better as compared to last year with 10.6 million fewer workers. We've seen the losses in working hours last year as well as the labor income loss, and we also need to be mindful of the uneven impact or uneven recovery as we observe that women and young workers are more adversely affected during the pandemic. Next slide, please. So we in ASEAN we have number of regional initiatives with regard to COVID-19 response and recovery. Some of the initiatives have been explained by Dr. Ferdi. For example, the COVID-19 ASEAN Response Fund, the establishment of the ASEAN Center for Public Health Emergencies and Emerging Diseases. But beyond that, we also have a number of initiatives that cover various areas for recovery, resilience, building, moving forward. One of them is the ASEAN Comprehensive Recovery Framework. Next slide, please. So this is a whole of community consolidated exit strategy that was adopted by the ASEAN leaders last year during the 37 ASEAN Summit. We address not only the direct short-term impact of the COVID-19 pandemic, but it also addressed on the three phases of reopening, recovery, as well as the long-term resilience. This document is accompanied by the implementation plan, which is an actionable initiatives. It comprises about 40 key priorities that will be implemented by the relevant ASEAN sectoral bodies to help ASEAN recover from the pandemic. The document is a public document, both of the framework and the implementation plan, and you may also wish to download this document to see what are the exact initiatives and key priorities that we are doing. The implementation plan itself is also a living document, meaning that it's also possible for us to generate new initiatives or revise, modify, as we've seen new challenges coming from this pandemic. Next slide, please. So the ACRF itself, it comprises of the five broad strategies. The first one is on enhancing health system. As Dr. Ferdi mentioned earlier, we have a number of initiatives in enhancing the health system within the region. But in enhancing the health system in the region, we also had a number of initiatives supported by other pillars or other sectors. For example, in the front of science, technology, and innovation, we commenced the so-called ASEAN Genomics projects. This is basically a project that will also help us in developing capacity building in virus genome analysis through a number of workshops, as well as provided us with the ASEAN-centric COVID-19 phylogenetic tree to aid the regional surveillance in ASEAN. On the second broad strategy on the strengthening human security, we put the welfare of ASEAN people at the core of this framework. So we want to ensure that this framework to be inclusive and provided enough human security in various areas. For example, in terms of food security, we have the ASEAN Plus 3 Emergency Rice Reserve Initiative, which at the moment we have already distributed more than 5,000 metric tons of rice to a number of ASEAN member states to help the people of ASEAN who are directly affected by the pandemic. We also conducted a number of consultation and dialogue with regard to migrant workers and then gender, including improving our sex disaggregated data to measure the impact of the COVID-19 pandemic to women and girls. The next one is keeping the economic integration open within the region. For example, I mentioned earlier about the MOU on the implementation of NTMs, that this year we add another 107 additional products on food and agricultural products to be included in this MOU. So we want to make sure that the region remains open on trade and investment. Other than that, we are now finalizing the ASEAN Travel Corridor Arrangement Framework. This is basically a framework that helps us to maintain the regional mobility without compromising the public health safety. We also understand that with regard on economic integration, tourism is one of the most affected sector by the pandemic. So we have finalized the post-COVID-19 tourism recovery plan, which are built upon the ACRF through the three phases of reopening, recovery, and resilience building. The fourth one is on digital transformation. We want to uh, keep ASEAN advancing the digital transformation agenda, but we also want to have this transformation to be as inclusive as we can. So a lot of emphasis are put to targeted communities, for example, on MSMEs, as well as youth and person with disabilities to be included in the agenda of our digital transformation. For example, this year we have launched the ASEAN Access, which is the website to help the international oriented small medium enterprises in the region to be involved in the regional value chain. We also improve the ASEAN SME Academy. We work with a number of partners to provide curriculum, educational materials to our SMEs. And this is also provided not only in English but also in local languages as well. So we can cover more outreach for MSMEs in the region. Other than that, we also put emphasis on the importance of reskilling as well as upskilling to youth and our workers in the facing of the fourth industrial revolution. And last one is on advancing towards sustainability, which also cover, we acknowledge the importance of urbanization as well as the smart cities, that we think this is an opportunity for us to build back better, and we understand that business as usual is no longer an option. So a number of initiatives are conducted, for example, on sustainable investment, sustainable finance, agriculture, including on disaster management as well. Next slide, please. So this is the 40 key priorities on the ASEAN Comprehensive Recovery Framework. On the broad strategy 5 on sustainability, we commit on having a sustainable development in all dimensions. For example, we are now gearing towards transition to circular economy. and also protection on environment, for example, on the reduction of marine debris pollution. We also facilitate the transition to sustainable energy, where at the moment we have surpassed our target of uh, energy intensity right now at the 21%, more than what we have targeted at 20% on energy intensity. And we are now also halfway in increasing our works in renewable energy as well. So a lot of initiatives have also been conducted on building green infrastructure as well as green transport. For example, developing guidelines on uh, road freight transport, which are sustainable in the region. Um, and last but not least, on promoting the sustainable financing, for example, which one of the initiatives that we had is the issuance of ASEAN Green and Social Bond Standards, which at the moment have surpassed more than 12 billion USD. Next slide, please. So these are three challenges and way forward that I'd like to highlight. I'd like to echo what Dr. RT mentioned earlier, that cities are crucial in COVID-19 response and recovery. More than 50% of our population are now at the urban areas, and the pandemic has shown that the urban population density can lead to widespread transmission. So we have to be mindful as well on the challenges on pandemic, climate change, as well as ensuring inclusive growth. Second, we remain to be inclusive. We commit to be inclusive by ensuring this is a whole of community approach on recovery. So moving forward, we need more targeted initiatives for segments of society that are most affected by the pandemic. Last but not least, I'd just like to highlight that the return to business as usual is no longer an option for ASEAN, but this will require paradigm shift, not only for the government but also for business and civil society to work collectively in enabling the systemic change needed by ASEAN. So with that, I'd like to end my presentation and over to the moderator again. Thank you.
Thank you so much, Arif. Colleagues on the line, I understand we have over 100 participants on the line. If you allow us, we might continue on a little bit over time since we started a bit late. So thank you for that. Over next, we're very fortunate to have with us a representative from the grassroots community, Ate Rube from the Homeless People's Federation of the Philippines. And as we know, COVID-19 has disproportionately affected the urban poor and low-income communities. So Ate Ruby, we'd very much appreciate to hear from you about the activities and the initiatives that are led by the communities themselves in addressing COVID. So thank you so much, and over to you.
Thank you, Tom. Thank you also for the opportunity to share our experience, especially responding the pandemic. Next, please. Our organization is working with the urban poor and low-income settlement with since 1990s, and we have 102 communities around the country, members, and our strategy is to encourage participations of the poor and facilitate their inclusions in the development, include community savings, citywide community mapping, community-led and acquisition, community-led upgrading initiatives, and other efforts. Next, please. So our organization also supported by 4 institutions, and we call this as the Philippine Alliance. Next, please. Next, please. So last March 15, 2020, lockdown in Manila was imposed, and weeks later, with the spread of the COVID-19, community quarantines were imposed in different areas throughout the country. Next, please. So more than the health risk, the lockdown, quarantine, social distancing, and other NPI measures exacerbated or magnified the poverty and inequalities experienced by the urban poor. So these measures imposed contain special spread of the COVID-19. It results the loss of jobs, livelihoods, and particularly among informal workers who really rely on selling goods and services. And then the loss of income increased food security also, and affecting particularly the children, elderly, and other most vulnerable groups. The situations of communities with no adequate basic services before COVID-19 worsens, having the no access of clean water and reliable power. So the long lockdown, the social distancing protocols also contributed to problems in mental health and increase in the incidence of the gender violence against the women and among the families. Next, please. So what we are doing is we do the community mapping data as basis in responding to the needs of the community during the pandemic. So we also put all the data in all the community, especially those who are affected in the virus. Next, please. So communities also take part in responding, especially to address the hunger and food scarcity. We do the community kitchens, which also managed by the community, local communities to address the food scarcity. Next, please. And then part of the response is to also provide some wash facilities, which is initiated also with the community to prevent the spreading of the virus and also continuous information and education campaign materials for minimum health protocols in the community. Next, please. One of the response also is the community health monitoring provisions of the supplies like alcohol, PPEs, face masks, and other supplies to prevent the COVID-19. Next, please. And then we had also community care and mental health consultations with the barangay health workers and facilitated webinars about mental health to the community. So we connect to the other institutions and the barangay health workers to also capacitate the community in terms of how to address basic health protocols in the community, like giving them some trainings in the community. Next, please. So communities also take part in doing the urban farming towards improved food security and close coordination with the government agency. Especially in Quezon City, they have also some program which also partner to the community in doing the food security and giving some seedlings to the community to provide more vegetables, and also part of the activity of the community also to strengthen their relationship even that there's a pandemic going on. Next, please. So what are the lessons learned? This risk is also we learned about the gender mainstreaming. Also, we learned about the remote coordination with the limited access. So sometimes we cannot do our normal activities because of this situation. We established some monitoring system to continue the monitoring of the community, especially those who are affected of the virus, and then the coordinations with the BLGUs and the LGUs, so barangay local government unit and the local government unit at the city level, because it's very important that we will be partner with them because the resources is there, but the community also need some support even though they are doing some initiatives on the ground. So we continue this initiative with the support of other partners outside the country and also the local resources. I will end my presentation. Thank you. Tom, you don't have sounds.
Thank you so much, Ate Ruby. A very comprehensive presentation and covering extensive areas, including mapping physical support to basic services and information sharing as well. So thank you so much for sharing. I'm just checking to see if we have Dr. Suraj, who's back on the line. I know that there was some power cuts a bit earlier. Dr. Suraj, are you there perhaps? Okay, while Dr. Suraj is coming back online, I'm sure he'll join shortly to share experiences from the International Society for Health. Paula, if we might, if you're available there, we've been developing and supporting Cities and Pandemics report, which you've contributed significantly to. And perhaps handing over to you to help offer some reflections on the presentations by Dr. Ferdinand, by Dr. Arti earlier on, and Arif, as well as Ruby, and much appreciated for sharing your insights and joining with us here today. Over to you, Paula. Thank you.
Thank you. Yes, I was thinking that apart from thanking you very much for inviting me to raise some further points on the topics of the session, I was really thinking to sort of expand on these interesting points so far during the session by bringing them sort of onto the map, bringing these health and other sectoral issues to a spatial questions that we could ask and analyze regarding the priorities for COVID recovery, and on the necessary structural shifts towards more productive and resilient urban areas in ASEAN and elsewhere in terms of health and economic production and prosperity and equality. Especially, I'd like to pick on the urban social spatial inequalities and so on. As you said, while doing this, I lean on the research of UN Habitat during 2020 on the early impact and responses of cities to the pandemic, sampling some 1,700 cities and some case studies worldwide. So there's three things that I would quite like to bring to the discussion. Firstly, when the pandemic had just emerged last year, COVID cases were, as we know, up to 95% urban. But by the third wave of the pandemic, the disease had moved to smaller towns and rural areas. However, according to Habitat's analysis, responses in these areas were only most effective when guided in a synergic territorial scale manner with major urban nodes. This finding was, in fact, already familiar to those following MDG results, because it made it clear that territorially defined and spatial interventions were, for example, more effective in terms of poverty reduction. So now, in other words, we found the same, that many countries or areas that have poorly connected small cities, only a new form of a governance approaches that believe in interconnected urban networks, dynamism and support can respond well to the pandemic in their own territory and therefore protect larger cities as well as the whole society. Then, so the second point that I would like to bring from our learnings from the COVID is that at the city level, about the notion of density. The structure and functions of cities per se were not found in Habitat's analysis, not to be found of the culprits of the high COVID caseload, but it was rather overcrowding and unplanned densities that mattered. Cities with high densities presented a more efficient response to the pandemic in various cases. And the key factor in this regard, we found, is the distribution of public goods and services to all during the pandemic, sort of both response and the recovery elements. And this is best achieved in cities with optimal densities, allowing for effective service delivery. And we have also other studies, we know, such by OECD and World Bank, that have indicated same regarding sort of so-called good densities or adequate densities. So also Habitat's best practices analysis showed that the local response was relatively strong regarding to sustainability by those governments that articulated actions through multi-level coordinated actions, such as also highlighted here today by the earlier speakers, and specifically when these actions are articulated at the neighborhood scale. So our takeaway was that we must reorganize the form and function of the city to adopt to better future environmental resilience. And then my last point is on the findings on access to health and other essential services during the pandemic and in the recovery stage. Firstly, the pandemic was fundamentally an X-ray of the society as we found it. It made very visible even the most invisible inequalities that we have in the cities. And this is surely something that ASEAN is also very concerned and addressing, as we know, in its strategies going forward. And what was remarkable in our findings from among the pandemic is that it was not only the impact of the pandemic that hit the poorest worst in our societies, but it was the emergency measures, such as lockdowns, that hit also the most vulnerable worst. And the recovery initiatives and investments are many times also leaving them behind. They are not in the first row in the recovery efforts. We found many strong indicators on these. For example, in Mexico, 73% of the people who died had not finished even primary education. However, they represent only just about 20% of the population in Mexico. Similarly, we were analyzing that in our sample of cities that only 1 in 4 of the responses taken by early 2021 on the pandemic recovery were carried out with community participation, something that our colleague was presenting as her concerns on the importance of a community inclusion. So we thus see that the world cities need much more deliberate policies and actions to address inequalities in terms of access to services. And this will happen only if cities understand that they need to address the causes for what UN Habitat defines now as new types of vulnerabilities in cities. These new vulnerabilities, they're predictors of higher disease prevalence, and we found them to be associated mainly with 3 aspects. Was very interesting. These were place where one lives, certain types of mobility and transportation, and type of works one has. These are among the key resilience risks that governments must take now to coordinate and to take a coordinated action on by multi-sector, green, just and territorial investments to keep everyone and every place safe and resilient towards a future. But of course, in ASEAN, we have now a good opportunity for this in the review and update of the Vision 2025 plans, and also in the future operationalizing the ASEAN Sustainable Urbanisation Strategy, and following the transformational policies towards the preventive agenda, such as the UN Secretary General is calling for. But then I have to note that we also have challenges at hand, since as UN Habitat's World Cities Report data from the last 20 years shows, over 70% of cities globally have actually moved towards increasingly equal in terms of social, spatial, and economic trajectories. So these are surely the challenges and also some ways ahead. But thank you for your time, and over to you, Tam, and for the discussion from here on. Thanks.
Thank you so much, Paula, and sharing the background and some of the key findings that have evolved out of the Cities and Pandemics report, and certainly covering the issues regarding the structure and the function of cities within that context as well. Colleagues, we will need to close soon so that we can go to the official closing ceremony of the ASEAN Sustainable Urbanization Forum. So if I may, from our colleagues and technicians on the line supporting us, from SCAP here, if we can please have the panelists just rejoining back on the screen here now. If before we close the session, we did have one question from the audience here, among many, but one of which that was quite critical for our assessment moving forwards as ASEAN member states in the region here as well. And the question was essentially about, to what extent has COVID-19 really changed the way that states prepare for future pandemics, and essentially as we consider what are the necessary strategies for cities moving forwards to become and emerge as more resilient as well. So if we may, we'll just have a quick round, and if you would be so kind to share your reflections upon this and a short remark or statement as we close out this session, this special session here today. So perhaps in the order that we've started this, initially over to yourself, Dr. Arti. Many thanks.
Thank you so much. So certainly this is a very important question, that how we've actually used this opportunity of COVID in building a future emergency preparedness. As I've already mentioned in my presentation, I would like to reiterate here, COVID has actually brought to forefront the health emergency preparedness. We have come to realize that the future, when we think of emergencies, when we think of cities at the heart of strengthening emergency capacities. And that is rightly happening. Another thing which has been focused during COVID has been the communication management. It's the risk communication and the crisis communication, the way infodemic of rumors and misinformation was there. There's now a lot of digital approaches we've seen during the pandemic. And this digital world, which is built during COVID, is something which is going to further strengthen our health emergency preparedness. So cities are at the heart of emergency preparedness, and this fact has been highlighted by COVID pandemic. It's a major health crisis which is actually brought in forefront the efforts we need to strengthen our cities and urban settlements. It also highlighted the challenges the vulnerables have, as Paula also mentioned about the inequitable and access to especially the most vulnerable. That also has been, brought into limelight by COVID. So all these aspects put together, the efforts for multi-sectoral and whole of society approach is the way forward to build healthier societies, and healthier cities will certainly be a futuristic approach for strengthening emergencies. I rest myself here and thank you so much for this.
Thank you sincerely, Dr. Arti. Over to you, Dr. Ferdi, for your guidance and your closing words. You might be on mute, Doctor. Yep, thanks.
Thank you. So let me share with you one of my perspectives or our perspectives. One of the lessons that we have embraced and still adapting as we are living with the challenges of this pandemic is that we need to be more flexible, more nimble with our COVID-19 policy and program approaches at the national or community levels or city levels. And this should be proactive to the needs of the peoples. And it should be providing proactive solutions to the people and not to the politics. Thank you.
Thank you for sharing that and your advice there. Over to you, Arif. Thank you.
Yeah, I think there are two things that I can take from the pandemic. First one is more than ever we know that we need to be mindful of uneven or differentiated recovery that happen in the different segments of society as well as the different countries. So we need more specific targeted assistance or program initiative to more targeted population as well as those at the vulnerable groups. But second, we also need to understand that there are limitations. So some areas we can do at the regional level, some we can do at the national level, and more than ever now we need more enhancement or improvement in improving the capacity of cities in responding to the pandemics. So we have to collaborate at the different layers, different levels, both at the regional, national, and city level in containing the pandemic. So that's the key points that I'd like to raise. Thank you.
Thank you so much, Arif. Since Paula, we have you on the line, maybe a few quick words, and we'll actually let Ruby have the final word on behalf of the panelists. So maybe over to you, Paula, very briefly.
Thank you. Yes, I would perhaps just like to emphasize the importance of this multi-governance and coordinated actions between all stakeholders across the vertical and horizontal lines, so that we will really be able to move truly away from the isolated actions that are sort of taking into account one sector in each case, because as I was referring to, this has not been seen kind of being a game changer. And when we count together all the serious crises that we are living in, with the climate change and the pandemics and the risk of future pandemics, we really know that what we need are those game changers. And therefore, this kind of discussions with clear action points and structural changes being planned for the pipeline is really important. And I'd be really happy to be able to help ASEAN in behalf of Habitat to take that kind of multi-sector, multi-governance actions. Thank you.
Thank you so much, Paula, for sharing that. And finally, and last but not least, as a representative of the grassroots and the community, which all of us here, of course, as ASEAN member states, as
as countries and as organizations we serve and support. Over to you, Ate Ruby, for your reflections and some few thoughts on how we move forward in togetherness with the communities that you represent and serve as well. Over to you, Ate Ruby. Thank you so much.
Thank you, Pam. Yeah, this pandemic also tests us, especially the community, on how to build strong relationship with one another. Because if we rely on the support of the government, which they also tested in this pandemic season, that they don't have the system, especially the health. And what happened in the Philippines is that they have these lockdown policies that are largely order based, but not really supported in terms of funding and in terms of resources, and they are not managed to support the health sector and the basic welfare of the community. So this is also the eye opener of everyone, the government, the community, on how they will also strategize and really help the most vulnerable group, especially the elderly person, the physically challenged person, because they are the one needing most attention in this situation. But for us in the community, we try to collaborate with the government, because community really does a lot of to address the situation, because if they are very aware, if they are really implement those protocols, especially in the community, they will also help stop spreading the virus. And I think we also test that situation, wherein the community really put up strong policy in terms of how they will accommodate visitors and other people not belong to the community. So it's quite good practice, and we learn a lot of this situation. Thank you.
Thank you so much, Ate Ruby. So distinguished panelists and participants, thank you so much for your time and joining for this special session on COVID-19 recovery in ASEAN. As you've heard in the presentation, cities are at the heart of the pandemic. And as we already know, half of the ASEAN region already live in urban areas. And by 2025, we anticipate that there'll be another further 70 million people in the region. So I encourage you and as participants to spread the word about the initiatives that ASEAN are leading, from what Dr. Ferdi has shared about the ASEAN portal on public emergencies, the ASEAN Biodiaspora Virtual Center, which I'm sure will be a landmark center for information sharing, and the ASEAN Public Health Emergency Coordination System. So please do share and promote these activities that ASEAN are leading upon, and at the same time, keeping in mind the guidance from Ate Ruby and those that of which we support within the communities and to strengthen their capacities, particularly those marginalized and vulnerable populations as well. So with that, thank you so much, Dr. Ferdi, for being part of the session, and other distinguished panelists today. We're very grateful for sharing, and from WHO for joining to share your experiences, and I'm sure you have many and a large task ahead of you. Thank you so much, participants. And with that, we hand back and close the session today. Thank you so much.
Thank
Hope
you.
everybody has a lovely day.